Central nervous system depressants include what we call sedatives and drugs that we call hypnotics. And sedatives bring about sedation. They inhibit the activity in the central nervous system. They calm us. We become less nervous, less excitable, less irritable. And if a sedative is given in large enough doses, they can put us to sleep. In fact, you'll find out that sedatives have a use in sedation, moderate sedation, putting us to sleep for short surgical procedures and diagnostic procedures. Hypnotics are drugs that actually cause sleep, and they actually have a stronger effect on our central nervous system even than sedatives do. As I just said, a sedative given in a large enough dose can put us to sleep. So that leads us to the conclusion that the degree of sedation and hypnosis is dependent upon the dose of the drug that we're getting. At low doses, we get sedation, calming. At higher doses, we get sedation, sleep. There are three main groups of central nervous system depressants that we're going to talk about: barbiturates, benzodiazepines, and miscellaneous drugs, including the Z drugs, non-benzodiazepine Z drugs, and also a melatonin agonist that mimics the effect of our endogenous melatonin and puts us to sleep. Bearing in mind what you learned about sleep back in pathophysiology, that we have sleep cycles that repeat over the course of a 7 to 8 hour typical night of sleep, and that it's divided into rapid eye movement phases and non-rapid eye movement phases, and each phase has kind of a different purpose for us. And one thing that we need to bear in mind when we are giving medications to people for insomnia or for sleep disturbances is that the various drugs that are used may have an impact on the sleep cycles, in particularly rapid eye movement cycles. Some drugs, sedative hypnotics, if used for longer periods of time, will actually reduce the amount of time the person spends in their REM sleep cycles, and that can be a problem. It's disruptive on sleep, and so many hypnotics are not indicated for long-term therapy for insomnia. And then some drugs may cause a kind of rebound increase in time spent in REM sleep. In other words, when the drug is discontinued, the person may end up spending more time in deep REM sleep for a while.